All right, then. So we're being joined by Honorable Lukman Lawal, who is the special advisor to the Speaker, Federal House of Representatives on budget and finance. Honorable Lukman Lawal, thanks for joining us. Good morning.
Good morning, Mr. Victor.
And it's nice to have you join us.
It's a delight to be on your program, The Side Mirror.
All right, then. So we'll still come to the kind of support that you are providing for vulnerable people in the state. But first things first, what is the driving force behind your interest in the health insurance scheme of Lagos State?
Well, I am an advocate of human capital development over the years. I believe that yourself and a whole lot of people can attest to that. When we talk human capital development, we're talking education, we're talking healthcare, and we're talking enhancement of household income.
All right.
You know, so those three legs have been my trajectory as a citizen of Lagos, as somebody passionate about better living, better welfare, better life, better society. You know, so over the years, I've contributed in my own little way, you know, to such ventures across the states and across the country.
All right.
You know, so yes, so it's always been a part of my my person and my trajectory.
And particularly for the health insurance scheme, I'm just curious because now you're trying to see what you can do to provide some support for the vulnerable. So why that interest, really?
Yeah. So basically, I was privileged to work in the civil service in Lagos. You know, before I got an opportunity to serve at the federal level 7 years ago. So during my work period in Lagos, I was there when the NHIS Act was domesticated.
Okay.
You know, the Lagos State Health Management Agency law was signed in 2018 during the Ambode administration.
All right.
And so I was one of those that was directed to work on the implementation framework, financial, operational, and all the rest of them. So it was something I was really passionate about. I know for a fact that all over the world,
all right,
health insurance is the only panacea to providing qualitative, accessible healthcare to citizenry.
Okay.
You know, so I was really looking forward to such, you know, initiative thriving in my space and in my country, in my state.
All right.
You know, so I remember, you know, working and getting stuck at defining an indigent, because one of the provisions of that law, you know, of the NHIS Act and the basic and the Lagos State Health Management Agency law is the basic healthcare provision fund, which is supposed to be 1% of the consolidated revenue fund of government.
Okay.
So the law is saying that there must be a provision for the indigent or the vulnerable to be able to access qualitative healthcare, and of course we are expecting that the citizens would key in en masse, and then we will not leave anybody behind because you are an indigent or you are vulnerable.
All right.
So for me, defining an indigent at the time was difficult. I mean, is it somebody living less than $1 per day? How will I even know whether you are living on less than $1? Because a lot of our people are in the informal sector. You know, they earn cash, spend cash. Is it somebody living in Ajegule or Ikorodu and all that? So we left, you know, some areas with challenges about defining an indigent. So over the years, I kept asking my colleagues in Lagos, how far with the health insurance? So they kept saying, oh, we are moving on. So a few months ago, I ran into the present PS whom I had worked with, you know, over the years, Dr. Lamba.
Okay.
And I was like, Dr. Lamba, how are we doing? She was like, my brother, people prefer to buy Ashoebi.
Instead of keying into the...
They don't want to pay. They don't want to pay for health insurance premium.
All right.
And she was like, you know, for those of you in government when you are doing empowerment, please let health insurance premium be part of what you are doing for the poor and vulnerable. That's stuck in my head. And
now you're trying
I just wanted you to understand the background.
Right.
Yes.
All right, then. So for those who are still missing out on this, really, because like I said, as we speak right now, figures at our disposal still indicates we're less than 2 million that have been enrolled into the scheme. So for those that are missing out on this, of what benefit is the health insurance scheme to Lagosians? I need you to break it down for us.
Yeah. So the Ilera Eco scheme, and I'm not speaking for them, but I'm just saying that as we know all over the world, keying into an health insurance scheme means that your family is covered. You have children, you have a wife, you have an elderly. You never know when these people would fall ill or need a medical attention. So the next thing when there is a medical emergency is you are jumping on the vehicle to go to the hospital. And usually when you get to the hospital, you are expected to pay for card. For government hospital, you don't pay for consultation. Consultation is free. But for private hospital, you have to pay for consultation. You have to pay for scan, X-ray, and all the rest of them.
All right.
So most of the time, because of our low purchasing power and low savings culture, we can't bring out this money. But when you have prepaid your health insurance premium, you just walk into your health service provider who checks their records to say that, you have been enlisted for the facility. They go ahead, check you, give you drugs, administer whatever test or procedure, and that's it. You are very happy, you are going home. And you go there again as much as possible times in the year.
Right.
So this is a culture that we must advocate. That this is a culture that we must advance. This is a culture that we must, encourage our people to embrace. It is the way to go.
Right.
Also, employers need to key in, by bringing their staff into the health insurance scheme. And as I'm talking to you now, I was shocked when the PS, Dr. Zamba, sent me the list of service providers. A whole lot of private hospitals have been captured on the Lagos Ilera Eco scheme.
So let's talk about
a lot of private hospitals,
which is very, very good.
Hundreds of private hospitals. Yes, our people may say, government hospitals that they are going, I'll go there and queue. No, all our major private hospitals across the 20 local government and 37 LCDs have been captured as service providers. They have been onboarded onto the Ilera Eco scheme,
which is very good.
As a concerned citizen, I do things for my people, in Lagos Central, and as I'm talking to you in Surulere, in other parts of Lagos, I'm planning something for this weekend.
All right. Just a second. We'll come to that. Lagos Traffic Radio 96.1 FM update from the control room says within the area of coverage, that's talking about areas like Ekpe, Mojoda, connecting Itamarun, Itakpo, and Ayeturu. All those corridors very appealing. Within the Ekpe end, things are still very, very good. And within the Yaba, Onyigbu, and all those corridors, it's slow. We have some portions there where we have bad portions of the road also adding to the mix, and so I think traffic has backlogged towards Otto bus stop beyond that's Oyingbo. This is Oyingbo towards Ido. You have some bad portions of the road there approaching Ido proper. That's what's happening. Motorists are making use of the BRT lane for now. That's a report coming in from the control room. All right, so Honorable Lukman Lawal, what intervention are you bringing for the vulnerable people as relates to Ilera Eco?
Okay, so like I said about my trajectory over the years, anything that would improve development.
Okay, so your line is a bit cloggy. Hello, Lukman, your line is a bit shaky. Yeah, I think it's better now. Go ahead.
Better now?
Yes.
Yeah, so I'm saying that I'm an advocate of human capital development.
All right.
On the 3 legs are education, health, and enhancement of household income.
Okay.
As I speak with you, I have something coming up over the weekend on Saturday precisely.
Okay.
Where people will get capital operational assets that would enhance their businesses, And apart from that, I also wish to give health insurance premiums, for vulnerable households. So I've earmarked health insurance premiums for 50 households in Lagos.
50
households.
All right. So how can they plug into that? For those who are listening right now and they want to plug into it, how can they?
So I have my team. We have been profiling people across the state, especially in Lagos Central,
Okay.
Lagos Island, mainland, Apapa, Lekki, and all the rest of them.
Okay.
So of course it cannot go round. But instead of giving people cash handouts, we would rather give this health insurance. So I'm going to give maybe 4 to your listeners this morning.
Oh.
But I would want people who are vulnerable. There's not somebody who can afford qualitative health care.
Okay.
I want families who are struggling. If anybody is calling in on behalf of another vulnerable family, is allowed. So you just give us the name of the person, the phone number, and the address. We would send somebody down to check them up.
Okay.
They have to take their bio data details, and capture their face, and then onboard them onto the Ilera Eco scheme, where they will choose a service provider closest to them.
Okay.
And then they can access antenatal, neonatal, different medical services for a whole 12-month calendar year.
Oh, great. All right, then. So 4 people on this program, right?
Yes.
Okay.
Yes,
All right. We'll take that in. All right. As we round it off, really. So, for those who are still skeptical about the scheme, the health insurance scheme, how can you convince them this morning that they need to plug in, Honorable Lukman?
So we just have to keep the flag flying, keep the good news spreading that we have a functional health insurance scheme in Lagos. It is working. It is affordable. The team at the Lagos State Health Management Agency are working assiduously, to make sure that all kind of services are captured on the scheme, and very good healthcare service providers have also been onboarded on the scheme. So it is a very good win-win initiative for all Lagosians. We should be proud of this one. That's the only thing making UK, US, Germany, and other countries that we run to make them who they are today and what they are today in the healthcare delivery sector.
All right.
We need a functional health insurance scheme where funds will be pooled and services will be made available, to citizens at affordable rates. So I'm using this opportunity to say Ilera Eco is functional, is working, and people should embrace it and get onboarded on it by paying their premiums.
All right. We'll leave it at that for now. It's nice connecting with you on the program. Thank you so much for linking up with us this morning.
Thank you, sir.
Okay, then. So we've been talking about support systems for the vulnerable in Lagos, the health insurance dimension, and Honorable Lukman Oyewole Lawal, who is a special advisor on budget and finance to the Speaker of Federal House of Representatives, has taken us through that excursion. So you heard it, four persons, all right, on this program, the 4 callers that I can pick this morning during the second segment of the program. You'll be granted an opportunity to win that. A brief break. When we return, we'll continue the conversation.